My name is Tom Morris, Tommorris. I am the Associate Administrator for Rural Health Policy at the Health Resources and Services Administration.
Thank you. And let's talk about the importance of this roundtable discussion here in Centerville today.
Sure. Well, today actually is National Rural Health Day, and we've been celebrating that since 2011. It's an effort to sort of lift up rural health nationally, and I think today's activity is a good example of that with the Enhancing Maternal Health Initiative. Basically, what we really hope to do is just be here, listen, learn, find out what's working, hear some about the challenges they have, and then really sort of see if we can take what we learned today back and have that inform our programs and our policy work in Washington.
And when you talk about rural areas such as, Centerville, and I know there are several other areas across the country, what challenges does that present for maternal health?
Well, one of the big challenges we're having nationally is that fewer and fewer rural counties have hospitals that offer obstetric services, and so that puts a big burden on somebody if they're going through a pregnancy, and that means they have longer distance to travel. It can lead to more preterm births, and that puts more risk in terms of that situation. So traveling, the distance traveled to care, access to regular prenatal care services, all of those are more challenging in rural areas just because of lack of providers and geographic isolation.
What are we finding that's working to help, in these particular areas?
Well, I think a good example is what we're going to hear today, that there's a great partnership between Cahaba and the local hospital. They work hand in glove to make sure these services are available, and I think that sort of collaboration is critically important in rural communities because if they don't work together, it's not going to really do what it needs to do.
Is this a growing problem, a growing concern across the nation right now?
Well, certainly the lack of obstetric services. Right now, 59% of rural counties do not have a hospital that offers obstetric services. So that's been a growing concern over the number of years. And yet we know that there are examples of places that are able to still do that. And right here in Centerville is a good example of that. They have a residency program that trains family medicine docs to do obstetric services. The health center and the hospital work really closely together. So it can work. This is maybe a good model to sort of promote more broadly nationally.
Great. And why is this so important to you?
Well, I just, I think that everybody deserves access to care. And so anything we can do to sort of, whether through our programs or our policies, help communities sort of make sure that they can, have a functioning rural hospital, have strong primary care, access to behavioral health services, all of those are critically important. And so I know it's important to the folks there, and it's important to us as well.
Thank you so much.
You bet.
Appreciate it.